Good morning, and I want to welcome all the participants in this virtual session. It's an honor and a privilege to share with you a few words about our new School of Public Health and to introduce our founding chairs of our departments. I'll go first. My name is Dr. Vasan Ramachandran. I'm a cardiologist by training and a cardiovascular epidemiologist. I've had the honor and privilege of working in the field of cardiovascular epidemiology for the last 3 decades, including serving as the principal investigator and director of the Framingham Heart Study before I moved to San Antonio, Texas. Our school is new. We are an ambitious school. We are ambitious for you as prospective students. We are ambitious for the people of San Antonio, Bexar County, and South Texas. This is an important moment in public health for the region as well as for our country. Never before in the history of our country has the importance of public health been so right front and center. We are coming out of a pandemic, and the public health workforce needs are very clear. It's also clear that the way we have practiced public health could do with some major upgrades so that we are able to restore public confidence in public health, maintain public health, and prevent the next pandemic. And that is the context in which this new School of Public Health is born. Our educational philosophy stems from the very basics of what has been called as Bloom's taxonomy. That is knowledge that the students will acquire, and then the students understand or comprehend that knowledge through application in practical means, through applied practical experiences, and that gives them the opportunity of analyzing public health problems in San Antonio, in Bexar County, in the region, South Texas, and also nationally and internationally. And the analysis part translates into the ability to synthesize the principles and practice of public health. And that translates into the last part where you metasynthesize or evaluate that knowledge to serve the public and the community whom we are hoping to serve. With those words about the school, I want to introduce our 3 founding chairs. Dr. Tracy Barnett is not able to be with us because she's of an indisposition. Dr. Barnett is the founding chair of the Department of Quantitative and Qualitative Health Sciences. All our chairs have over 2 decades of experience in public health. Dr. Barnett specializes in sociology and in quantitative and qualitative health sciences, and her area of expertise and research include tobacco use and smoking cessation. Dr. David Gimeno Ruiz de Porres, who you see on the screen, is our founding chair of the Department of Environmental and Occupational Health Sciences. Dr. Gimeno comes to us from the University of Texas, Houston campus, School of Public Health. Dr. Gimeno is a trained psychologist and also a social and occupational epidemiologist who has expertise in multiple aspects of occupational and environmental epidemiology. Dr. Cristina Barroso is our 3rd chair, the second one you see on the screen. She chairs the Department of Health, Behavior, and Society. Dr. Barroso comes to us from the University of Tennessee at Knoxville, and her area of expertise is health promotion. And again, all our chairs have over 2 decades of applied practical experiences in public health. So with those introductory words, I want to hand over back to CEO Duncan, and I wish all the people on the panel good luck with answering the questions. And for the prospective students who are participating today, please engage and participate with the panelists. We hope to see some or a lot of you in the fall of August this year. Thank you.
Thank you very much, Dr. Ramachandran. All right, so I would like to go ahead and get started with our questions today. And I promise you don't need good luck. So let's start with a two-part question. How do you define public health? And what led you to your interest in the field of public health? Dr. Barroso, would you like to start with this question?
Sure. So there are many definitions of what public health is, but the big thing really is to look at public health more than just the lack of illness. It's really about well-being, physical, mental, social, environmental, all aspects of what impacts daily life, quality of life, and overall well-being. The other thing too is that we really need to look at what is public health? Like, what are the functions of public health? And there are three core functions. First is to assess, hey, what's going on? What's happening? And that's where our qual and quant department comes in. Second, looking at policies that influence well-being for whomever you're addressing. And you need to remember, when it comes to policy, policies are socially constructed ideas that address certain problems at that time. And so that's why policies change from time to time. And then third is to assure that everyone's getting what they need. And that's really, and the policies and assuring is really hard because, again, it really depends on what people think is the most urgent issue. But those are the three core functions of public health. And so I really think that they play a role in how we live, what we do, and what we address. And our goal here at the School of Public Health is really to make life better for everyone in San Antonio, in the region, in Texas, and beyond. So that's how I think of when I look at public health. How I came into public health was actually roundabout. I am a first-generation college graduate, and I think many first-generation college students, when it comes to professions, where we're usually thinking it's medicine, nursing, teaching, engineering, business, and then other services like police officer, fire person, things of that sort. And since I had an affinity for science, everyone told me, oh, you should go to medical school. You should go to medical school. Wonderful, noble profession, but it wasn't what I wanted to do. It wasn't until after I graduated from college and I was actually working in a gastroenterology lab, putting my BS in biology to work, that I learned about epidemiology. Because the researcher I was working for needed someone to look at stats in his department. And since I was at a teaching hospital, they had an epidemiology course for the MDs. And I asked him, can I attend this? I can learn and then bring it to the lab. And he was so gracious that he allowed me to do that. And that's when I learned about epidemiology and public health. And so it wasn't until 4 years after I graduated from college that I learned about public health. And the rest was history. I fell in love with the idea of really impacting well-being at that aggregate level, which is what public health is. We're not looking at individuals. We are to some extent sometimes, but we're not really working on the individual. We're working at that population level to make impactful changes so that it's well for all.
Thank you, Dr. Barroso. Dr. Gimeno?
Hey, hi, everybody. I don't think I have a lot to add, but let me qualify, I guess, a few things to take it to a different level. But I will say that public health is a multidisciplinary, interdisciplinary, transdisciplinary, all this adjective you can put. It's not just one thing, and I think that my colleague here just provided that idea. But also when I stress that there is an need for systematic and organized planning of actions and effort to create these conditions to prevent diseases and illnesses, but also to promote health. So there needs to be a consistent and coherent and organized effort. I mean, the science behind public health. And the second level of that, so one is the systematization and organized planning to create the conditions for health and well-being. And I will say that the other part is, and again, my colleague touched on that when mentioned medicine, that without disregarding the importance of the immediate causes of health. In my case, I can think of some environmental pollutants in the air that cause some damage in the DNA, and then you get sick. So without disregarding these more immediate causes, I will say that public health has a very keen interest on the causes of the causes. Or, you may have heard this expression of the social determinants of health. So these are the social, economic, and environmental conditions where people are born, where people grow, where people play, where we live, where we learn, when we work, and where we get older, and eventually, and sadly, but part of life is where we die. So this the whole life course has all these conditions, and some of these things are good for your health, and some of these things are not. So in public health, we will try to minimize the things that are not good for your health and promote the things that are good for your health. And for that, in public health, we come from many different disciplines. Myself, I'm a psychologist. I was trained as a clinical psychologist. I was practicing psychologist in a primary health care center. And I will say this, trying to save the emotional life, the mental, health of one at a time. And eventually, at least for me, it wasn't enough. So I guess I was fortunate enough to have people around me to point me in the right direction of public health and realize that I can have an impact at a larger scale. For me, that take the shape and form of the workplace environment, and where us as a workers get affected, and how can we create the conditions for a healthy lifestyle, and both mentally, I mean, still has very keen in terms of the mental health of the working populations as well.
Dr. Gimeno, how did you, what introduced you to the environmental occupational field?
Because I was working, I was working at a young age, and I realized that all these things that happen around me are important, right? Yes, my diet is important, and but my physical activity is important, etc. Right? The classical thing, whether I smoke or not, whether I drink or not. But there are other conditions that have to do with both the psychosocial environment of where you work. Everybody can think about stress at work. But also the physical and the structural conditions of the air that we breathe, the light that we're exposed, all the things, the noise, whether we work with noise or not, and how distracted and stressful that can be. And so I have a keen interest on how workers get affected, and then the extension really I will say that in the last 10 years, CDC, the Centers for Disease and Control of Diseases, and NIOS, the National Institute for Environmental Safety and Health, have been pushing this idea that is called the total worker health. That is not only the prevention of injuries and illnesses, but also everything that surrounds a worker, which has to do with nutrition, but has to do as well with what you take from home to the workplace, and what you take from workplace to home, really. And the potential idea that is not only that we can make you not sick, when you return home, but maybe that we can make you healthier, at the workplace, in a way that you can positively influence others around you. Obviously, it could be your immediate family, but it could be your, colleagues in an extended way. It could be neighbors. It could be, the idea of really community is brought about here. That it's the community of the workers, but workers also are parents, and they have many other different roles, right? There are neighbors, there are friends, we all wear multiple hats, and all these things, if you can think about happening in dimensions, right? You take your kids in the morning, but you go to work, and then you do something else, and you have fun. It's still yourself. So as a worker, because, if you are lucky enough to have a job, unless you're a millionaire, you're happy enough that you don't need to work, but still you have interactions in a workplace environment of some sort, and those things can affect your health, positive, negative.
Great. Thank you so much for that answer. Dr. Barroso, I know you are the chair of the Health, Behavior, and Society Department. So can you share a little bit more about what is that department? What does that mean?
Thank you. So I think those three words really tell you what the department is: health, behavior, and society. Much of the current illnesses, diseases, chronic conditions are really impacted by behaviors. We've survived the COVID pandemic, which was an infectious disease, but the reality, that infectious disease was much more severe for individuals who had existing chronic diseases. And most of these are really based on modifiable risk behaviors. So alcohol use, tobacco use, poor diet, lack of physical activity. And what really happens is what Dr. Gimeno was saying, how the environment and other aspects influence what we do on a daily basis. I really see my department really looking at those type of issues that impact health, that impact behavior, that impact society. So really not working alone, but working synergistically with all the other departments to really train people about community, defining community, looking at different aspects of community, integrating community into research, into different things of that sort, helping community to do health promotion that's satisfying for their needs and their desires, things of that sort, as well as looking at how community can also influence policy so that policy reinforces the healthy default rather than the unhealthy default. Because unfortunately, we currently live in an environment that's unhealthy. It's cheaper to get high calorie, poor, dense foods. We all live in an environment where we work in an office or in a place where we're sitting 8 hours of the day, and we know that's bad for our bodies and things. We live in cities that don't have great public transportation, which require us to travel an hour to and from work. And so, our lives are very sedentary. So it's really looking at these different things and working with the other departments to really have a more comprehensive understanding of what impacts public health. But I would say that the big things are really going to be community integration, defining it using theory to then look at different aspects of health.
Perfect. And I love that you also touched on community. I know this is an academic focus meeting today, but we do have a whole department on community engagement, and that is definitely a focus of our school. So yeah, I appreciate that you brought that up as well. I want to ask also, for each of you, I know your background and just your current interests, there are aspects of research that are involved. Is there anything that you would like to share with our community today about, the type of research that you're involved in or what you would like to pursue through your department?
Yeah, I can go for a second here, but as the environmental, occupational, there are these two big areas, right? One can think of the environmental health focus as one to develop preventive strategies to reduce potential health effects of air pollution, water pollution, contaminants on populations. You can think about the vulnerable populations that they may have less access to, less water of quality or soil that is being contaminated or close to an industry, or that, you live near a big road, right? Whatever, 1604 here in San Antonio or I-10. And then also you have the other connection here. The other circle, let's say occupational health, then is a similar focus of developing strategies to promote then a safe and healthy work environment. Obviously, there is overlap, as I said, because you can think about the environment as something that is a big umbrella where there are workers and non-workers and so on. So really, there are interactions at many levels, and I will give you an example. So one of the studies that we're conducting here is on domestic workers. This is a group that we've been working on for the last 7 or so years. There is a group of mostly female, mostly Hispanic, Latina workers that clean houses. These are typically women that do not work for a company. They are individually employed. Yeah, I see a message here, Domésticas Unidas. Yes, we work with Domésticas Unidas, kind of a hub, but then we connect to others. I see a heart here, so yes. And one of the interests, 7 years ago or so when they come to us was that they were reporting that working with certain cleaning products were making them sick. It was an overall report that they have, or that they have allergies, or they have asthma and so on. So that is one of the ways that sometimes also we start scientific inquiry that is through the community that may come to us and say, hey, something is happening. Can you help us to see what it is? Can you help us to work out the issues and so on? So we've been working with them, identifying the compounds, or some of the compounds that are in these cleaning products. Some of them are called VOCs, that is short for volatile organic compounds. There's things that you breathe out. Some of the things are smell. Think about all these products, for instance, that smell like lemon. Those are VOCs. And working with them also, identifying that how much of that is really causing you a health problem in the mix that is not unique. You are not in a vacuum. You are not in the lab, and you are also carrying something with you. You may have another chronic disease. You may have other exposures, obviously, right? You're actually exposed to benzene through, if you are in the street, and, Texas, there are many cars, right? So it's not a clean city in that regard. So we've been working with that, with them in this cross between environmental exposures that relate to the workplace, but also where they live and where they work from home to their workplace and so on and so forth. So this is one of the classical or the good examples of this interaction of these two dimensions that we are doing.
Great, thank you for sharing. And just for contextual awareness for our attendees today, Dr. Barroso, I believe this is your second week on the job, so she is still, establishing her department and, figuring out the direction that she would like to go. So I just wanted to provide that contextual information. However, I do want to ask, is there any specific interests that you foresee maybe engaging in?
Things that I've been thinking is a big focus will need to be about families and children. Given that children are our future, and behaviors are established in childhood and track into adulthood. So I do think that there will need to be some type of focus either on child adolescent health or maternal child health, overall well-being. And we do know that unfortunately chronic diseases are also very prevalent among our youth in San Antonio and other places. And so I do think that that's going to need to be part of the forefront. But you can't talk about kids without talking about parents and without talking about grandparents and things of that sort. So I really see that the life cycle is going to have to be really addressed through all. It might be that early childhood, young adults, and then middle age, and our aging population, because we do know in San Antonio that Alzheimer's disease is very prevalent among our older adults, Latinos, Latinas, Latinx, Latinas, as well as in the Black and African-American community. The numbers are increasing. So aging is another aspect that I think that we also need to focus, and exactly how and what I'm open to, but I do think that we're really going to need to look at through the life course perspective.
Wonderful. Thank you for sharing. I also want to let our attendees know, like I said, this is an academic focus today, but we do have an entire research enterprise that is part of the School of Public Health. So part of Dr. Ramachandran's research and other team members are definitely involved in research. So I do want to acknowledge that as well. For my final question, I would like to ask, from your perspective, what potential benefits can students receive by attending the University of Texas School of Public Health, San Antonio?
I will say this: we are a new school, but we are not in a new university. We are not new. I mean, and as Dr. Ramachandran in the introduction says, that we all have been in public health for many years. We're still young, and but we've been here. So I will say that what we aim to provide to people who will join our programs is a comprehensive and solid education with practical skills and in public health practice, theories in administration, provide hands-on experience, not just theoretical, but hands-on experience. We have a solid relationship with the public health department, both at the city level and at the county level, which also will contribute to networking opportunities, working with diverse population. And as I mentioned, I think that we have a very idea of being excellent at what we do, but not create these silos of excellence, but collaborate across departments. Just because we have departments and it's the way that we typically organize, that doesn't mean we're gonna be everybody in their own corner. We want to really create and have an approach and a mission that is interdisciplinary, interconnected, and I think that the third main thing to me when I think about a potential, a new school of public health in a place where there are many needs is, and this thirsty sometimes about I want to change the world, but I say, okay, think globally and not local, right? A lot of public health global issues start, when you go out of your house. I mean, even in the house, but they are there and they are present in the city. So I think that allowing or creating the opportunities for students to be connected to the real world that is around us in San Antonio and South Texas in particular, but obviously beyond, that is really what we're aiming for.
I agree with what Dr. Gimeno said. I think that our transdisciplinary approach is really appealing because many large institutions, schools of public health, although public health is supposed to be transdisciplinary, they're still very siloed. And as you can tell, the founding chair of environmental science also has a behavioral science background. I also have a human genetics training in my past. So we're very transdisciplinary. So we might not speak that language specifically, but we know enough to help you speak to each other in different types of disciplines within public health. So that transdisciplinary component is really appealing. And then the other thing that I think Dr. Gimeno kind of touched on, but didn't really focus on, is that we're really student-centered, student-focused. We're developing our program in a sense that it's really catered to the needs of the student, that such that they're getting the skills, the ability to practice interactions with others to really help them build these skill sets that they need to be outstanding public health professionals. And so it's really a student-centered, student-focused program.
Yes, absolutely. And you both touched on it. I want to mention the experiential learning, practicum aspect that will be involved in this inaugural degree, the Master's in Public Health Practice and Administration. That is something that we actually did touch on a previous virtual office hours. So if anyone was not able to attend that, please feel free to check out our YouTube channel because Andres Jaime did, bring up a lot of the interaction that students will be able to have with the community.
Sure. I'd just like to say thank you to everyone who attended our virtual meeting. Super excited that there's so much interest. You know, feel free to email us, contact us, and you know, this is an opportunity for all of us to make an impact in San Antonio. So I'm excited to see everyone's interest, and just thank you.
Same thing, just, you know, keep an eye on us and contact us if you need anything specific from any of our departments.
Yes, and I want to thank you both for joining us today. I know I actually learned some things as well, and hopefully it was beneficial to those who attended today. We are really excited about the School of Public Health, and we are here to help. So if there's any additional information you're looking for about our program, please contact us, and we will get you the answers that you're looking for.